No, I don't like seeing myself. Who's here? I see Cole.
Yep, I'm here.
Hey, hi Cole.
Hey,
How's it going?
it's going. How are you?
Just Andy.
Yeah,
I see
still
Nate.
still getting used to this.
Yeah, I know. I'm not crazy about it. I wonder how I turn up my volume. See, that must be it. Oh yeah, there we go. This is a new computer and I don't like it. I mean, I don't not like it. I'm afraid of it. There we go. Okay, here come the girls. Nate.
Hello.
I hear you, but I don't see you.
Oh yeah, I have my camera turned off.
Okay.
I just have dinner right next to me and a dog. So
I have the dogs, but eventually you guys are going to see the cat because she's just going to crawl right over me. So, catch the belly. That's what she does. So you guys had any classes yet, meeting like this?
Yeah, I had 2 classes this morning.
yeah.
How'd that go?
Pretty good. Just like I said, just trying to get used to it. It's definitely weird and
Yeah, it's gonna be an adjustment.
Yeah. I see the ceiling with you, Cole. You're gonna make me dizzy.
Oh, I'm sorry. This is off my phone.
Oh, okay. I'm using 2 computers, so if you see me look away, I'm not being rude. I'm just trying to. Somebody just let me know. It said, "Are we meeting on Zoom?" I'm like, yeah.
Yeah, I don't get it. People just for some reason haven't been checking their emails.
Yeah, I noticed some people haven't logged in since before break, which I understand that, but
Yeah. I mean, in both my classes, there were about 5 people missing.
really.
Mm-hmm.
I mean, I think there was a mixed message. It was like, hey, take a week of break, but they didn't indicate like you should log on and check your messages. They're like, well, we sent out surveys. People need things. You're not responding. Well, you told them to take a week of break, but maybe that's.
Yeah.
Yeah. Right. Let's let me go. Oh, if I use my other computer, mine is so slow. Oh, I hate living where I live. The Pony Express would be faster. Yes, yes. Wow. Oh, did you find the bio, Cole?
Oh yeah. I didn't really find much without you studying the official bio.
Okay.
But I found some stuff, not a lot.
Really, I'm surprised.
I mean, like her social media, I think is a lot private. So unless like I friend requested her, wouldn't be able to get on like her Facebook or Instagram.
Yeah.
And LinkedIn basically just said about where she went to school.
Yeah, she's pretty impressive. I wrote an article about her long time ago. I'm trying to think what year it was. It's got to be like early 90s.
Oh, wow.
Yeah, you could ask her about that. It said, just say, didn't Dr. T write an article about you? What was that about? just say we couldn't get it. It was in the archive.
Yeah.
Just see what she says about that, because she's impressive.
So is this speech going to be about her or about, what she's dealing with right now with the coronavirus?
What she's doing right now.
Okay.
She's visited my classes before when I taught at UW. So I thought, maybe she'd be available just given the time difference. And she happened to mention that she got tapped for this task force. I'm like, great.
That's perfect. Yeah.
Yeah. And then a person next week, her name's Ginny, and she works with the First Amendment Coalition. So that would be good background for you guys talking about open meeting laws and agendas. And we might have a lawyer from Philly who works totally with those issues. Or we might have him later. We talk about journalists and First Amendment issues and libel, and so I might do them a couple weeks later. I
Awesome.
might have a panel next or 2 weeks of people how they're covering meetings in remote setting. How's that working, and other issues with transparency. If I can get my couple of my reporters together.
Awesome.
I call them, they're the crusties. They've been at the they are at the Sun Gazette for like 30 years. They're tough as nails, but I mean they're grouchy old men. So, but they're the defenders of democracy. So if we can get them, I mean, it's 6 o'clock is a difficult time. So
Yeah.
but we will see. I think if I can get one speaker every week, that would be ideal for you guys. As opposed to listening to me talk this way, because I think that would just be that would just be too boring. So okay, I see Styles and I see Dane.
Hello.
Styles, I can't see you though.
I don't have a webcam.
I'm sorry.
Hello.
Dane, I don't see you, but I just see your name.
I have to go grab something really quick. I'm gonna grab my notebook. I'll turn my beautiful face on then.
Okay. Because I miss you guys. If you don't put your faces on, then I see myself, and I'm really not thrilled with that.
Mhm.
I really need a haircut. Well, I've got the audience here. So I'm trying to think who else. Right, so we got, if I'm correct, it's 5:57. So let's wait for Ben, Whitney. And yeah, okay. So I understand. Oh, here she comes. The president should make an announcement. Yep, yeah, yep, maybe tomorrow. Yep, here she comes.
Oh, it's a cat.
Yep, it's a cat. This is Grubby. Hi, Grubby. Might make an announcement by tomorrow if we're going to be remote the rest of the semester, or just say hi, Grubby.
I got a feeling we probably are,
Yeah,
which
it is.
sucks.
Yeah,
Because I mean, like this class, like it's kind of better for meeting in person instead of web chat.
yeah. Really? This was clean. This is a clean scarf. Now it's open. I'm gonna sneeze. Yeah, I told you to do this. Hi, Whitney.
Hey, how are you?
Good. How you doing?
Good.
As everybody's here, we'll do some announcements, and then our guest will join us about 6:30. That sound. I'm sorry.
Jesus Christ.
Well, look at that background.
That is beautiful, Amira.
Thank you.
That's San Francisco, I presume.
Yeah.
Wow. Wow. Look at that. The artiste. I'm so envious. Oh my God. Right here.
Where's my pen?
How do you do that? I want to do that.
The virtual, how did I do it?
Like virtual.
Virtual background.
Yeah,
thing.
choose virtual background.
What?
You got like a million options.
Where's the virtual background thing?
What is
Where
that?
is it? I don't even remember.
It's right next to the video thing. It's the little arrow. Just click up. It's right under video settings.
Oh,
I could be like in Paris or something.
Like we can be
Oh my
somewhere
God, that's
else
awesome.
while it's doing quarantine.
I know, huh? Wouldn't that be nice?
so you add an image or wait? Okay.
I thought you were done with this. No, you're gonna stay here. Oh, good God. Oh. Well, it could be worse. Well, I have a porch kitty that I feed, and he's a boy, and she doesn't like him. So sometimes she like screeches. So it could be worse. She could be screeching at him. I think she's a cougar. I think she wants a date with him. Yeah. He's like a year old and she's 10. Look what you just did. Oh my God. There's fur everywhere. Grubby. Yeah. You're the devil. Everything's wet. Thanks. Okay, we are 6:02. Is anybody, who else are we missing? I see Cole, I see Whitney, I see Amira, I see Nate. Who else? I hit my arrow. Ah! And I see Styles. Oh, there's Kyle. Kyle in the corner.
What's up, Kyle?
What's up?
Is that Ben? You got hair.
I'm here.
Okay. Well, I didn't recognize you. Ever changing. Okay, well, let's get started. People pop in, pop out. It's gonna take a while to get used to this. I don't like seeing myself. I'm really not happy about this. I just don't like that face. And my desperate need for a haircut. Okay. So I just want to start with some announcements. Then you guys can ask me your questions. We'll do as best we can. So I will send you probably a different Zoom meeting each week, and that's just because each announcement is going to include an invitation for a speaker. So I'm going to try and have at least one speaker every week, or sometimes I'm going to have a panel of speakers. So that's why it'll be a little bit different. But I'll try not to be, on Zoom for more than an hour-ish every week. So we don't have to be 3 hours. So you don't have. I talked to my department chair. I said, this is a 3-hour class. Please don't tell me we have to do this for 3 hours. And she said, absolutely not. So that's why I'll be adding to your readings with, some webinars on NewsU, or I might send you some PowerPoints, but I think I'm more interested in you having the ability to develop the same skills as if we were in class. I can't do it the same, as if I was there, we're doing small groups. But if I can give you the option to still walk away in May with the same skills, the same writing skills, the same knowledge of AP, that would be my goal for you. So keep reading the chapters. Oh God. I'm sorry, there's just too many people and too many animals in this house. As long as nobody barks, we're good.
And we have to watch every speaker each week?
Yes.
Okay.
Yeah,
And it's going to be like part of our class time?
Yeah, that'll be the basis for your assignments.
Okay.
And it's also an option for earning extra credit. So I'll get to that in a moment. So the skills labs, through NewsU, and they're all free right now. Pointer made them all free, which is pretty amazing. And there's a couple other options through Sage and Cengage. They're the ones who publish your books. They're making more exercises and webinars available too. So I'm gonna keep looking at those. But I've worked with all these groups for years. So we might have done some of them in class anyway. So don't worry that I'm gonna keep you from 6 to 9 looking at this for 3 hours. Okay, so plan for an hour-ish. And next week, our speaker is from the First Amendment Coalition. She was a reporter for 10, 12 years, 5 different states. So she's got all kinds of things to say, but she's been with this First Amendment Coalition for almost a year. So she will talk to you about the importance of transparency during government meetings and how you should dissect agendas and things like that. And she'll give you lots of examples from her classes. And she's offered up some of the attorneys that work with her, so they may come back in a couple of weeks when we start talking about how to protect yourself from libel and malice and those types of things, issues that I was going to cover at the end of the semester. So we've got a lawyer from Philly who's going to volunteer to talk to you, so they may be like a panel. And then the week after that, that would be April 7th. I'm trying to get a couple, I call them the crusties, some of my longtime writers at the Sun Gazette, and they will talk to you. Hopefully, again, it's based on availability and what's happening in the news, but how they're managing to cover, government meetings remotely, because it's really easy to, not be available to reporters and not answer the questions and just slip all types of things through without taking a vote, not allowing citizen participation or ask questions because they're in 5 different places. So I call them the defenders of democracy. These guys are, they're right there. So I'm going to see if they're available. If not, then I have some of my associate editors as backups. How are they making their decisions when I'm not there? So either way, I'm going to try and get as many, people in the field to talk to you. Get off my leg. Just go. Just go. Yeah. So those are my plans. All your assignments we turned in on Dropbox. So I'll make a specific Dropbox for each assignment, and then I will download it. I'll save it with my initials, CTH, and then I will write my corrections in or my suggestions in. I usually enter it in like a blue color so you can't miss it. And then whenever we have speakers, again, 2 extra credit points for a good question. So a good question is not a yes or no question. So this would be a good time to practice developing your questions. So can you tell me, can you give an explanation? What are your thoughts on, really open-ended questions that would lead to greater discussion. I'm still figuring out how we're going to do our AP quizzes. I still want to do a couple more just to make sure you're knowing this. In the meantime, I'm going to keep adding some content to D2L. I got a couple worksheets that will just explain why you use said, for example, and when you can use believes. Somebody said he believes, he said he hopes, just some distinctions. I've got a couple guidebooks here I think that will help you improve your writing. That's all I got. What are your questions?
Will the Dropbox be on D2L?
Yes.
Okay.
When is our article thing due?
This one is due next week. The speech is due next Tuesday.
And then what time? Like, is it due by midnight? Is it due by?
5 p.m.
And this speech assignment's what was originally going to be us going out to find speakers. This is going to be the same thing, right?
Correct. And if you
Okay.
already did something, that's fine. But this is just presuming that you weren't able to.
Yeah, gotcha.
Yeah.
And then you're looking for us to base it off of the speaker that we're having today.
Correct.
The news you, how do we submit that?
Yeah, I had some trouble with that.
I can log on because I'm me, and I can see that you finished the course. So if you guys use the same login that you did that we did in class.
I don't believe I got that login because I made my own account.
Yeah, I don't remember doing that either.
Then
Yeah.
I just went on Pointer like we did in class.
Yeah.
left early, and Cole, you weren't there.
Okay. Is there any way I can get an email on the information?
Yes.
Okay, awesome. Thank
Me as
you.
well.
So was one of the assignments like coordinated with the NewsU account thing? Like, was the assignment coming from that?
Yeah, you're supposed to read
Okay.
something.
Yeah.
I don't remember what it was. Yeah. It was a reading.
It was like clarity and some clean and concise something with writing.
Is that something we're turning into a Dropbox or completing
No.
on the?
If you complete it, I can look at it and see it.
Oh, okay. All right.
It used to be that you guys were able to use my Michigan State account, and Michigan State paid for everything. But now everything's free, which is pretty wonderful. A lot of educational organizations are making everything free, which is just really amazing. God, I'm covered in fur. Questions. So your assignments are basically going to be the same, and you have the same amount of quizzes. I'm just going to try and adapt them so I'm bringing everything to you as much as I can. If you noticed, I don't know if you've been looking around D2L, there's a folder that has links to all kinds of the local government organizations, so you can see when their meetings are and when and how they're meeting remotely. So unless there's a school board or something that I didn't include, you're welcome to find your own, but at least they're listing on their homepage how they're meeting. For the ones that usually meet at night, some of them are meeting during the day and they're on cable. They're listing on their homepage, you know, what their plans are.
Is our class going to be extended?
I don't know. They haven't come up with the schedule yet. They keep saying they're considering adding weeks and.
From what I've
They
heard
they
from my
extended the semester until May 9th, and then the finals would start the following week.
that's what I've heard.
Emails.
Like for my visual comm class, it's extended to like May 10th.
Yeah. Which doesn't make any sense to me. Oh, stop. No. But they don't ask me. I mean, a lot of faculty teach other places, and our summer school hasn't canceled, so. But it's okay. Other questions?
So when's the due date for the assignment gonna be?
What we just talked about?
Yeah.
It's like we just said, next Tuesday, 5 p.m.
Are these Zoom meetings going to be recorded or put anywhere else, or are they all live?
They are recording. Yeah, we're recording. So I could put them someplace.
Yeah, if like when the speaker comes in, so that we could like go back through and like, well, I guess we'll be catching live quotes as we're going.
Mm-hmm.
Okay.
I will double check with her and make sure that's okay, because I didn't ask. I imagine she'll be fine with that, but so check D2L on the announcements page and make sure that I can do that. Other questions?
Now the article, that's to be in the same format as our first one was in?
Correct.
Okay.
What do you think would be the easiest format for you in terms of taking your AP quizzes?
I mean, there's a quiz section on D2L.
Yeah, I did.
I was gonna
Yeah,
say
I
the same
saw
thing.
that.
You think the same format is just giving you sentences and you find the errors? You think that would work?
Yeah, that's fine. For
Yeah,
me,
I
at
think-
least.
Yeah. Not or any like question regarding the style or anything related to it.
Yeah, that should work.
Okay. And they'll be timed also, just like it was in class. In open book, I'll tell you in advance what it is, so you know how to prepare. Cal, are you in the garage?
I'm in my basement right now.
Oh, okay. It looked like a recording studio at first.
Well, yeah, I mean basement / recording studio.
Okay. Like you get the points for the coolest location because we know Amira's is fake.
Oh, I thought that. Yeah, it looks pretty real to me.
I know. I learned from prior years to move my workspace away from all my family pictures. Because in prior years, students were like, hey, who are those chicks in the background? You know, are they single? I'm like, those are my nieces, and you just failed class. You know, not dating my nieces, they're not dating till they're 35. What about that guy? That's my nephew. You guys stop looking at my family. So that's why we're looking out the window. Rookie move on my part. Okay. Anything else? I'm looking at any other emails I have. Did they tell me anything else? Boy, this is why I use the new computer, not the old one. Styles, you there? You're Styles, okay.
Yeah, sure am.
You sound like Styles like you're in the basement.
I'm just in my room. Nothing special.
Anybody do anything exciting over break?
No, I just stayed at home.
I mean,
I
I went
work
grocery shopping.
7 days a week.
I worked in a grocery store.
Oh yeah, what's that?
Yeah,
About?
me too.
What's that been like with everything going on?
It's volatile.
Yeah.
I will tell you that. We've had lower packs than police officers. I mean,
Whoa.
two
Oh,
to
oh
four
boy.
throughout the store daily. I mean, people can't control themselves.
Really?
It's very odd. It's
I
just
actually saw something on social media. It was in Australia, and this woman had a big shopping cart full of toilet paper, and then this lady wanted one pack, but the woman wouldn't give it to her, and then the woman actually started to get physical with the woman.
Yeah, no, I mean, it's a movie. I mean, the liquor stores are boarded up because they're trying to prevent looting. Is what they
Sure.
said. And I said, are we even there yet? Like, it's so bizarre. And you know, I work in the deli and the butcher, so we're done serving product hand to hand now. All we do is we cut it and put it out.
Sure.
It's very weird. No one's talking to each other, and if they do talk to you, they're on edge. And
Yeah.
it's just very odd.
I had orientation for my new job, and because of the regulations of how many people you can have in each room, like they had us at a safe distance, like 6 feet away from each other as far as tables. We had to wash our hands. As a test, we had to do a screening with temperature every time you went to work.
Oh boy.
They've
My
erected
mom and
these
I-
screens in front of the cash registers. They're called sneeze prevention something, but they're these like 5 feet tall, 3 feet wide, and thick glass from the cash register and everybody else. It's bizarre.
Where do they put the money? Can they like hand it around it or something?
I do not know what they do with money, to be honest with you. I
It's
don't know.
gotta
What
be like the dirtiest thing they touch.
I know my
Oh,
one
yeah.
friend. I took him to the ATM and he took cash out and he sprayed it with Lysol.
Wow.
I was like, I'm not. I can't be on that wave.
I know some stores have just stopped accepting cash at this point.
Yeah.
Whoa. You might as well close then.
I mean, I know Walmart's not accepting any toilet paper returns once this is all.
I went to Walmart today, actually, because I had to grab a couple things. Because I'm going to be working in the healthcare field. Everything, I had to get scrubs, because you can't really get scrubs at like a scrub store because they're closed. And Walmart's postponed with their deliveries. Go figure. So I went to Walmart to grab a couple things, and there's people like standing in a line along the walls of the store just to get their paper towels.
Wow.
And some lady approached me. I was on the phone. She's like, "Are you in line for paper towels?" I was like, no. I'm actually talking to my boyfriend to see what he needs from the grocery store."
Uh-huh.
He's like, "Well, if you are, like, can I go in front of you?" I'm like, "I'm not. Like, go ahead."
Wow.
I just don't get like why it's toilet paper that everyone's like panic buying.
I never got that either.
No, either.
Like toilet paper is not gonna do anything. Why like I've gone to like 2 Walmarts that are close to me and like the 2 Targets close to me, and like every dollar store I can find, there's no tissue paper, and I'm like, why?
It is gone.
Yeah, I know my warehouse, the warehouse of the store that I work at, we're not getting anything in until probably April.
Good luck.
There are even delivery places that are giving promotions for toilet paper. Like if you order like takeout from them, then they'll give you a free roll of toilet paper for like getting stuff from their business.
Oh my God.
Wow.
Oh, what does that say?
Buy one, get toilet paper.
Well, I don't know if you guys have ever heard of a company called First Quality. It's a big paper factory. So they're literally right across the river from you. Guess what they make? tissue paper, kitchen, paper towels and toilet paper. So we're like, if we run out, we're just going to storm the factory.
Yeah.
I mean, it's bizarre. And they're busy all the time. The trucks are going up. and
Yeah.
down the street, so they haven't stopped production at 24/7. But
Be a good time to invest in toilet paper companies.
yeah,
Yeah, definitely.
oops, what did I do? But I actually yelled it. I went to Walmart because it was the only place. Our two other stores were completely out of food. So I thought, okay, I
Jeez.
just needed some avocados. They had to have avocados. So someone said they had avocados. And this guy behind me who was working there, who had like probably 6 or 5 bins, he kept reaching over me. And I smacked him. And I'm like, 6 feet. And he's like, how? I go,
Yeah,
6 feet.
we
And
have
he's
signs.
like,
We have signs throughout our store.
hey, like, what is wrong with you?
That's disturbing. We have signs in our store that like all throughout the store now that preach that 6 feet away. And there was actually a local. I don't know if he was from Harrisburg but he was a Pennsylvania man. Got arrested for I think he was in a Walmart, walking up to an old dude and coughing and saying, "I have the virus."
Oh, I saw that. I saw that this
What?
morning.
Oh,
That's
Crazy.
that's just
He
not
got
right.
like terroristic, like it was like
Right.
terroristic threat. Yeah, that's
Easily. I mean,
All
shit.
because,
That's-
of
that's
like sneezing or
ridiculous.
coughing?
Huh?
All because of sneezing or coughing? Like,
Apparently the man deliberately walked up and coughed in the man's face and said, "I have
Ah.
the virus." Like, come on.
that's ridiculous.
Someone
He-
did that
he,
in my
like,
store.
could've,
She
though.
came in
That's
and
the
she was
thing.
like, she came in with money and she was like, I just got out of quarantine. I had corona for the past 2 weeks. I was
Jesus
like,
Christ.
okay. And then she left. She came back again and she started like coughing everywhere, and everyone just looked at her all of a sudden. It was like,
Yeah, that ain't funny.
Oh my goodness.
That's the thing though, like you probably could have had it though too. Like there's a lot of
Yeah.
cases where you don't know.
You just think you're sick and you get over it. You're like,
Like
oh,
I could
no.
have it right now and I don't feel a thing. I'm just chilling. And like,
and
Yeah.
some
you just
people
don't
are
know.
having
Yeah,
allergies.
and I think that's the big scary thing. Like there are a lot of people who are getting tests who are tested positive for those, but yet have no symptoms.
I haven't even tested it because I saw videos of like people getting the test.
Oh, the
Like you
test
put the
looks
whole
horrible.
thing. No, I saw the video of someone getting tested. They put the whole like
Thing
I
up.
don't know what it's called in the nose, and I was like,
No, thanks.
So you shove it up.
No,
Yeah, I
not
don't
a
think
thing.
very much.
Nope.
I make a point to do all my errands after I've gone for a run because I'm always coughing because of stupid cat. And I just tell them, I have a cat. I have a cat. I'm not sick. I have a cat. And I'm like, see, I just went for a run. I just ran. I'm not sick. So, but to have asthma is just like a really bad thing right now.
Yeah.
I have a double cat. All right, it is 6:25. So if you need to step away, get a drink or anything, because Lorianne will log in about 5 minutes. So you've got a minute to get yourself settled. If you need to step away, you could do that. I'm just going to do my feet because it looks like. Ow.
So how long is she going to be speaking for? Or is it just like until she stops?
That's probably it.
Yeah. As she's coming back, she'll be able to tell us.
Is anybody else still kind of confused about the assignments?
Yes.
Yeah. Oh yeah. I can.
I got the bio. I printed that out.
Yeah. My professor for my communications theory class, she hates this Zoom thing.
Yes, she does.
She absolutely hates it.
I don't know. I kind of like it so far.
I kind of like it. This is fine with me.
Yeah.
I mean,
Yeah.
it's a 3-second commute, so.
Yeah.
Yeah, that's cool. I don't have to drive anywhere. I'm saving so much on gas.
Yeah, I was
I
just going to
know.
say that. It's awesome.
Yeah.
And by the time this shit hits, gas is going to be like 75 cents.
Yeah.
Yeah.
Fucking.
I saw gas down to 210 at a Shell that's near me. Oh my god.
Oh,
I haven't seen it that low in a long time.
yeah, nobody's going anywhere.
It's
Yeah.
like Delaware. Yeah.
So
Yeah, I'm-
for visual comm, did you guys start your brochure yet?
No.
No, I'm.
Okay.
Did you see what we have to do to get access?
Yeah.
It's a whole
so-
process.
Yeah. So you have to go through like these steps. It's pretty easy to do.
I'm sure it is. Yeah, I looked at it, I opened it up once, and I was like, nope, I'm not doing that right now.
And it doesn't matter if you have Windows 10 or Windows, because it'll go like download details. So I already did that, and I have complete access to it, but I didn't start my brochure yet.
Have you
I
opened
didn't even
InDesign?
finish the monsters thing yet. But I have a feeling we're gonna be so much more lost. Just
Yeah.
like,
Oh yeah.
We have a CD cover now.
I
yeah,
bought
we're
that.
gonna
I
ask
bought
the
that book like
question,
you told me
like,
to, so I
email
better be
it
able
to her,
to
and
figure it out.
it's gonna be like a 3-day like waiting time, and then it's like,
I'm gonna have to send her an email because I explained to her before, because I'm going through CNA training to be a certified nurse assistant.
yeah.
And with the coronavirus, they had to set the class dates back a whole month.
Oh my god.
So right around when our finals are supposed to be, that's when I'm gonna have my classes, and I graduate with the hours. Like if I miss like 3 days of that like 8 to 4 period, then I don't graduate with my CNA.
Damn.
So I have to let her know what days they are, even though I think they're work days.
No.
Oh, jeez.
Oh, wait, oops. Read that. Hey, what are you doing?
I don't know. I just feel like the whole Zoom thing is making every class like, I wouldn't say harder, but just I don't know. You know,
Just more
it's just making
confusing.
it not as easy.
Yeah.
Yeah.
That's harder.
Okay.
It's just
Like,
not as easy as harder. I'm just saying.
I think it's just because we're cultured to the normal approach that we're doing that it's making it a little more different, that we're not, used to it. So I guess it's making it harder. Okay, whatever.
Use your words. Yeah, I'm not happy about it.
Yeah, in fact, one of my professors is not even using this.
So you just like not having any class at all?
No, it's like we'll still have class. He'll post a video in D2L, and he'll talk about like what he'll want us to do like at home, and then email or submit it to him through D2L or his email. So he said that's how he's doing it.
Okay, everybody, it looks like we're ready to get started. Ms. Stanislawski has joined us. Everybody ready? Put your notebooks. You all set?
Yes, ma'am.
Yep.
So I want you to, Ms. Stanislawski, she's going to talk to you a little bit. Hopefully you've had a moment to read her bio and done your own research. She's going to talk to you a little bit about her career as a public health educator and what she's doing now as part of a COVID-19 task force. And when she's done, she will signal when she is ready to take your Q&A. And remember, ask good questions. Don't waste your time, okay? Because she's very, very busy. Doing important work.
Aren't all questions good questions?
Yes. You start whenever you're ready.
Hey. Hi, people. How are you?
Good, how are you?
Well,
Very good.
How's this whole thing going? Learning online, etc., and not being in class.
It's
Crazy.
interesting. It's interesting to say the least.
It's an experience.
Yeah. Don't like it, huh?
Yeah.
I don't mind it.
One of my
fine with it.
professors doesn't like this because she said this isn't what you guys signed up for. Like, you signed up to meet face to face. Like, you didn't sign up to do the. So that's basically what
They
she.
can get a partial refund.
yeah. Yes. I'll back that campaign up any day.
Hey, now I give you money worth.
Yeah.
Never know. Okay, so what Carol, or I'm sorry, Dr. Teresina was talking about, I work in public health. I've been doing that for a long time. And I started out working in Chicago at an STD clinic, and then I worked there for a couple years, and then now I work in Wisconsin. And what I started out doing working for CDC is following up on cases of STD. So worked in a clinic, and then patients would come in and get tested and treated, and those patients who were positive would sit in a chair in the hallway, and I'd peek out my office, and there'd be someone there, and I had to call them in my office to talk with them about their infection. Okay, then make sure that they knew about their positive test and how they were treated and what they have to know about it, blah, blah, education. But really the important thing we wanted to do was to make sure that any of their partners would get tested or treated. So to ask about their partners, and then get information on how to locate them. But there's no cell phones. This is a long time ago now, before you guys were born probably. And then the next day be a field day. Go to people's houses, knock on the door, and tell them they've been exposed to an STD like syphilis, and make sure that they get to a clinic to get tested and treated. Sometimes you have to take them to the clinic. So that's called contact tracing. So that's looking for people who've been exposed, finding them, making sure that they're taken care of, that they are educated about their infection, or that they get the treatment they need, whatever it is that might be necessary. In the case of bacterial STDs, they get medication to prevent any incubating disease. So that contact tracing is pretty, that's the standard thing for doing STD work and a lot of other public health work.
That's borderline police work, going there to tell somebody that somebody passed away.
It is. It's really, it's very interesting. It's kind of like, it's a little bit medical. It's a little bit investigative, like police work, because you have to find people. It's a little bit like being a social worker and counseling them. Sometimes they're upset or whatever. So, I mean, you just never knew what you were going to get every time. And it's the most exciting work ever. It's the best stuff. So yeah, that's kind of the basis for so for a lot of public health work, you know, foodborne outbreaks. So, you know, what food did they eat? That, you know, in that case, you're finding out what food or what thing were they exposed to, et cetera. Anyway, so now we have coronavirus, and, you know, in public health, we've been waiting for when this kind of thing was going to happen, an epidemic, a pandemic. Well, you know, not if. So a lot of people are surprised by everything that's happening in public health. We are not surprised. I guess you're always surprised that it actually does happen, but the fact that, you know, the way that the United States and all the other countries are reacting towards it, and social distancing, closing things, etc., all that, you know, we knew that was a possibility at some point. And so, so people are energized about doing their work. They're not happy that it's happening, but they're energized about doing the work that they've been trained to do forever. So that's kind of, so, so how's it going there in your community? What's it like with cases?
I mean, you wouldn't notice much. I mean, there's not much of a difference besides people just not doing much else. I mean,
yeah,
the tanks aren't rolling down the streets, and there's no, dead bodies on the road. So, I mean, I don't think anybody's really overly concerned, but I mean, I think people are underwhelmed.
I mean, it's really
Yeah.
a social distancing thing. Like, when I went to Walmart, they had duct tape X's on the floor where you should be standing. Like, I saw the poor woman behind me struggling to hold her groceries because her hands were shaking, and I told her that she could put her groceries on the counter near me.
Uh-huh.
She was like, "No, I'm sorry. I have to practice social distancing. I'm not allowed to go anywhere near you." And the Walmart employee was like, "Yeah, that's right. She has to keep her distance from you. We got to keep you safe."
Interesting.
So she could have dropped her groceries and been just fine,
Yeah.
apparently, because of the
I live in Hershey, which is like around this time, it's a big tourist destination. And I live so close to like the main strip, Chocolate Avenue, that, and I work at the Hershey Hotel, but, we're not working because of this whole thing right now. Like we shut down all HE&R operations at the moment, but it was so odd because around this time it would be so populated and so many tourists coming through and the strip and all this traffic. But right now it's just like you don't hear a single car on the road, and I like it.
Yeah, and for me right now, for my mom and I, we're making sure that my dad is being healthy because about a year ago he got a double transplant. He got a new kidney and a new liver. So, and like our job with him is, so we pretty much told him, like, when things started shutting down, we're like, you are not leaving this house. like you are staying in here.
All right, you want him to stay healthy so he doesn't have to end up to go
Yeah.
the ER and for anything really, right?
Yeah, so right now with my mom and I, our job with him is to make sure that he's healthy as possible.
Yeah.
And as far as things being the way they are now, I mean, because you're in public relations, like, how long do you think, because you said we knew something was going to happen, it was a matter of when.
Uh-huh.
The protocol is right now, if things are going to stay this long for like months or weeks or.
Yeah, it's a good question. CDC is researching other countries to see what has worked and how much time. They're looking at all the numbers of cases coming in, waiting for the that leveling out of infections. You've heard the to flatten the curve, right? We know the epi curve, the epidemiologic curve. We don't want it to look like a giant, bell curve. We'd like to make a nice flat little hill, so just get it spread out. We don't want it to exponentially increase, which of course, it is in many places. We're just waiting for it to kind of slow down. And so one key thing in doing that is the keeping people away from each other. And just, the recommendation that you all know, that any flu season, don't touch your face and wash your hands and all that. People don't do that on a regular basis when like they ought to. And but now I guess it's really kind of getting drummed into people, right? And then the third piece is is contact tracing once again. So that's how I've gotten involved in the COVID response team. Is I'm writing scripts for people who are in public health, who do all kinds of other jobs in public health, but they're volunteering their time to do contact tracing. So a city or county health department, local health department, initially calls someone who has an infection. So they talk with someone who's a case patient with COVID and let them know that someone else is going to give them a call and, just kind of like check on them initially. And they're in a database, and we all have access to this database that it goes over the internet. So then we get in there, and then we can see how many people are either positives or someone who's already interviewed them and they have contacts that people they've been exposed to. So they try to find out when somebody was infected, when did they start their infection, and the thing that they can identify with that is that when did their symptoms begin. So when did their symptoms begin, and you go 2 days ahead of that, and that's the period of time where someone could have exposed other people to it and not known it. Talk about their people that they were in contact during that period of time. And also talk about what happened to them the previous 2 weeks and what sort of gatherings were they at and things like that. So, what goes in the database, of course, is the contacts. And so we have almost 200 people right now in Wisconsin who are doing follow-up or contact tracing. As I mentioned, like it's a standard thing that we've always done in STD. So now we're doing it with coronavirus, calling people on the phone. It's confidential. You got to make sure you have the right person, and let them know that they've been exposed to an infection with COVID, and whether or not maybe sometimes they know that, and sometimes they don't. So sometimes they, oh yes, that was my friend or a neighbor or my mother, or somebody who may have exposed them, and then giving them recommendations in their home. Whether it's just quarantine, if they have no symptoms, they have to just quarantine in their own home, try to keep the rest of their family safe by staying in a room and just cleaning surfaces, staying away from other people, etc. If they have symptoms, then they're doing self-isolation, and that is an even step up from staying in the room, and nobody can enter. They bring food to someone at their bedroom door, and then the person leaves, and then they open the door and take their food in. And it's really hard to do with kids, because some people have kids who were exposed who have an infection, and then what do? You have a whole family of people who are either half infected and the other half worried that they're going to get the infection, and sometimes they're leaving their house and they have to go out and get food or diapers or whatever.
Yeah.
So, but we do have a big contingent in Wisconsin. Most states undoubtedly have a huge contingent of people who are following up on contacts. And that is working in places where we can have enough people. In other countries where they're doing contact tracing, it's working. If you have enough people doing it, and people actually listen to our recommendation, right? In the US, I don't know how many people listen to the recommendations or understand it all the time. Sometimes not, Some people are very vigilant about it, and they're very appreciative that we're calling them. Others, they may not care so much, and they, I feel fine. I don't have anything right now. They're in denial, and so time is gonna tell how well it's working. So, but a lot of people who work in public health, again, who do all kind of vastly different jobs, are jumping in to do contact tracing. So that's part of my job, is to train them, to make sure that they have a script that they can talk with someone about. Because it's kind of like, I always said it was like sales. It's kind of like you're selling health. You have to make cold calls. You just call people out of the blue and say, hey, you've been exposed to an infection.
Do you believe people are more in denial than not?
I don't know. It's hard. There's so much in the media about it. I'm not sure how big that contingent is of people who just think it's a hoax, maybe, or they think it's just crazy, or but we would not be doing all these things if it wasn't really important, right? As I mentioned, in public health, we didn't know when an epidemic or a pandemic was going to happen, but if, not if, but when, rather. So when was it going to happen? So it's something that has been in our radar, but the regular person on the street, they don't think about that sort of thing. Right. And if you think about when was the last pandemic? Do you know when that was?
Ebola?
Would that be when the swine flu came out?
I heard
SARS?
a bunch of answers.
Was it
Spanish
SARS?
influenza?
Was it the swine flu?
The H1N1 in 2015. And yes, and then SARS, I heard SARS and MERS, and so there's, but the last one was in 2015, but most people don't know about it, because this one is just so much bigger, and it's the new virus that's really virulent. It's moving very quickly.
Speaking from a healthcare perspective, what do you think is going to change after this incident, and what do you think we should change?
Oh, that is a good question. What do I think is going to change? I hope people take things more seriously, even in a regular cold and flu season. to now that people are practicing some of these things, are hearing more about, again, the washing hands, covering your coughs and sneezes, you staying away from people who are sick. Maybe people have learned more about germ theory, and they'll be more cognizant of it, more aware of it, and be practicing it a little bit more. So I'm hoping that that's the case.
Do you think anything will change in like the healthcare industry besides public perception?
Public perception of the
are we going to have more preparations for stuff like this in the healthcare industry?
Oh, yeah. You know what? It's a good question, because most hospitals, communities, clinics, etc., feel like they're pretty prepared for things, or they try to be prepared. Okay. And since 9/11, there's been a lot more preparation for things. And one of them was, what happens if your building closes? What if the workplace closes because, of a bomb or a thing, whatever, something happens, what happens to the workforce, right? So that's a workforce development thing. Like, what will happen if it closes? Nobody thought about, seriously, even in public health. In our building, we have a continuation of operations plan about, if the building was closed because of a disaster or a problem, what would you do? We didn't even put in our plan, what if there's a global pandemic or an epidemic and everyone has to leave the building? So I think there's always something that you sort of forget. But a lot of planning did go on since 9/11, and there's a stockpile. There's a national stockpile of materials, things, medical equipment, etc., including the gowns and masks and antibiotics and all kinds of things. And that national stockpile has been open and being used. So we have some in our own state, as well as nationally get some from the federal government. And so I think we're realizing we're not as prepared as we thought, but it's really hard to do. You can't stockpile things so well that they just sit there and expire because they're out of date in some fashion or whatever. So I think that may be something that is obviously going to be reevaluated.
Well, when it comes to your state government, I'm reading a press release now saying that your governor now implemented a stay-at-home order.
Yeah.
But a safer at-home order prohibits non-essential travel. Some clarified and defined in the order above here. How do we stop people from getting into groups and going into spring break? How do we convince these people to stop? I don't know, going to the gas station to get cigars or cigarettes or, miscellaneous things. What's going to convince these people?
Yeah. I don't know. It's really, really hard to get people to believe it and to understand that their little bit really counts and matters in your community. We could liken it to voting. Everybody, we say to people, your vote counts, every vote counts, but there's still those people that are going around like, it doesn't matter, whatever happens, all the politicians are gonna do whatever, blah, blah, blah. They're just jaded about it. I don't know if it's a certain personality type, or I wonder what it is, that some people just have this denial about it, and not always a lack of education. It's a perception, and I suppose being in denial about it, because it can seem scary for people.
I work in a deli, and we're done doing hand-to-hand distribution of product to customers.
So what do you do now then? Tell me what you're doing.
We just pre-cut, bag them, and put them in freezers that we have now out in front of the. But to me, that I don't see that mitigating the issue.
Because you're still touching it, or?
The fact that we're still touching it, and
right, but you're wearing gloved hands.
Yeah, we have gloves.
You're not handing it to someone or something, and then
no. But then there are people that want it handed to them sometimes, and they want, I don't know, they get frustrated.
You just set it on the counter, and then you're like, there it is, take it.
No, we can't even do that.
Oh, they just pick their own.
Yeah, they pick their own.
Huh.
we fill up freezers and they pick their own.
Yeah.
It's very odd. But I didn't feel like it was mitigating the situation just because people are still around and some people don't wear gloves and they file through, whatever bag they're looking for, meat they're looking for, and
Oh, they're just touching everything. Yeah.
everything's being touched, and I'm just like, none of this matters.
That's not really helping. Yeah.
No.
And for the people who are just not getting deli stuff right now, maybe that's working.
I don't know, but we have hand sanitizers around the store now, but I don't know. I don't know how much that does to mitigate the problem.
Right. It's not 100% effective.
Right.
I mean, how many of you had your family members or maybe in school some health education, maybe when you were in grade school, talk about stuff like that? Like, if you're going to pick
I had things
grapes
talking
or something out of a bowl, like you don't touch them all, but
Yeah.
It,
there were talks like that.
Yeah. So people, so I think, I think it depends on if you've been exposed to those ideas before. That's one reason that, comprehensive school health education is a good idea. You could put a plug in for that. Starting with, very mild, I guess, topics as when kids are little, about hand washing and germ theory and this, as you go on and on, obviously at some point in my realm, they want to learn about STDs in junior high or high school or wherever it's appropriate in that community,
Well,
but
this
you have to
order,
have a basis for that,
this order extends to the 24th of April, and according to our commander-in-chief, it'll be done by Easter.
Yeah, what is with that? That's a surprise.
I don't know.
Yeah, like he made a statement today that he wants to reopen the country by Easter. Like,
Get people back to work.
I think he's kind of rushing it by that.
Yeah, and I was surprised that the terminology that I heard, and I don't know if I have it on my phone, but it was something to the effect of, maybe you guys saw this, it said, the economic impact on the country, of course, is difficult, and it's going to hurt people anyway, and so, like, people dying is kind of like a cost of business. It was to some effect that, like, that's just like the cost of business, like, which is worse, like business is going down, and I thought, well, which is worse? How about death? Death is worse than, your business going out of business. If the business owner dies, that's worse than the business going out of business. So yeah, I didn't understand when they said, which, weighing it, which is worse, people dying or, economic failure in some fashion.
In terms of the news, like, because every time you turn around, turn on the TV, the news is talking about the virus that's going around. How do you know
That's too noisy.
what is actually to be true and what is not true? Like, is there like a source that you would recommend that people should go to get the right information and precautions? I mean, other than like washing your hands and stuff like that.
Well, CDC, so the CDC website, Centers for Disease Control, and then each state health department that, really we follow, we're grants from the CDC and follow those public health recommendations from, physicians who are in public health, not just physicians who treat individual patients, but they're physicians who are trained specifically for community health.
What do you think personally needs to be closed down, like all the stores? Because I work at a gas station at Sheetz and we make food. We've closed down all the things that people touch, like the fountain stations, the coffee, the tea. So but we still make the food and we still have people come in. And it's more than 10 people at a time. Sometimes we have rushes, so there's at least 15 people. What do you think needs to be shut down completely? Like grocery stores, I know hospitals have to be open, but what do you think needs to be closed to help with the social distancing?
I think some of the initial closings were important, like hair salons, nail salons, that sort of thing, that, if they're not necessities, people can live without that. whether they prefer to or not. And I did not hear till today, which I forgot which one you mentioned. Was it Whitney about the Walmart, right? That is concerned enough that they are putting X's on the floor so people are
Yeah.
social distancing because they need stuff from the store. So it sounds like their team is really trying to make sure that they help their customers follow recommendations. That way their store might stay open longer, which is it's a good thing for both. So what should stay open and one should not? I mean, depends. And maybe each business should have some sort of rules or plans. And Amira, you said you work at a gas station, and are they doing anything about
Yes, as she
having a few people walk in at a time, or?
No, it's like because of like the way it is, it's a gas station / restaurant. So we have like people come in, maybe like 2 or 3 people. Then we have like teenagers come in. Then we have just the adults. So it's mostly like about 20 people at a time.
No, they're spread out
in the store.
Yeah, they're kind of spread out.
Yes. It's not really spread out because the store is a little bit small. It's not as big. So my gas station is a little bit small. So we have like maybe like 3 people or 4 people in a line, and it's like there's this little space between them. So there isn't that much space between them.
Yeah. Maybe you need to get those duct tape X's like Walmart. I haven't been to the store. I mean, I did go shopping, whatever last week, or whatever it was, a week and a half ago, and I tried to, get enough staples at the house so that I wouldn't have to really go to the store for a while. And then I ordered online, which that's something I don't normally do. So I ordered food and it was delivered. But not everybody has that option, especially if there's fees to that, depending on which stores do it. Or if you're in a community that is a grocery island, then what are you going to do? You have to go out. Or desert, a grocery desert. I said the wrong word. Right? What's it called?
Desert. Yeah, it's a food desert.
Yeah, grocery deserts, right? There are in some communities that are poor communities, lower socioeconomic. There's no grocery stores around. They only have the convenience store or the gas station, convenience store to get things. So what are people going to do? I mean, I think that the people who did go out and, purchase, I tried not to purchase too much. I purchased I'm gonna get enough staples or some basic things, stick some stuff in the freezer that I don't have to go to the store if I don't really need to, unless I need to get some fresh foods or whatever. But I think some people really, really, really stocked up, and I do have empty shelves at your stores too, the toilet paper scare and everything.
Yeah, I was at Weiss last week in a Union Deposit in Susquehanna Township, and like the shelves where they keep all the toilet paper and paper towels, yeah, there was not a single thing on the shelf.
Yeah, it's crazy, isn't it?
Yeah.
I never understood why people are getting as much toilet paper and paper towels as they can. That's the one thing I'm having trouble.
All right, I heard that. And maybe one of you could look it up there in your computer while Google it. That somebody said that a lot of the toilet paper was made in China. And a rumor came out that we're not going to get any toilet paper shipped to us in the future, and so that's just started a whole snowball effect of people doing that. They don't want to run out of something that they totally need.
Well, from what I've heard, working in retail, having people come up with thousands of rolls of toilet paper a day and then having them thrown at myself because we limited it. People are saying that it's because of the China thing, and also because apparently they heard a rumor going around that we're going to be forced to be shut into our houses for months on end.
Oh, goodness.
Yeah.
So they're just stocking up.
Right. And so part of it I think is a rumor about how China we're not going to get toilet paper from China anymore, which is probably not really true. And then people saying, we have to be shut up in our house and we have to do this, and we're being told that, well, you know what? All of it so far has been recommendations. They are all recommendations. It's not, public health recommendations. And I guess the governor's order is an order. And yes, you can get in trouble for it, but they're not sending police around to look for you. They're hoping that people comply, and people have complied, but who mentioned earlier, someone said, no, there's not tanks up and down the street, and you don't see police, getting people in trouble for being out after a certain period of, a certain time of day or whatever. I think a lot of it is just really great that people have been listening to it, and that they really see that it's important, and they don't want to get sick, and they don't want their family members to get sick. So I don't know. I see it as a really positive thing that people have been complying to the degree that they already have, even though we're talking about those people who are just, who is not going to do it, and why aren't they doing it?
In terms of public health, what sparked your interest to work in public health and do what you're doing?
Oh, that's a great question. Thank you. So what sparked my interest in it, when I was in college, I wanted to do something to help people, and thought about maybe like working at Planned Parenthood or Red Cross or something like that. I wasn't really thinking about public health in big picture. And then one of my professors came up to me and said, hey, CDC is going to be here recruiting people. I want you to go. I was like, oh, okay. So, not a lot of planning in there. Yeah, go. I'm like, all right, I guess. Sure, I'll go. But they saw that I was interested in that. I worked at the Wellness Center on campus as well. And so then I went and I applied for the job in the STD for CDC, and I got the job, started working in Chicago at a Southside clinic. And it was just amazing. Like I said, it's such a fantastic combination of things to help people when they're sick, when people are in a great need in STD, that, no one cares about STDs. We don't get a lot of money in public health for STDs. And, sexual health is just not something that's so valued all the time in our society. And here's people with a need, because just like, air and water, breathing, social interchange. But sex is a true physical need for our society. And there's so much stigma against STDs. It's just like, it's like getting a cold from somebody. I'm talking about bacterial STDs or what, something more mild. But yeah, it's like, so someone passes something on, they don't know that they had it, they accidentally pass it on. It should be like no judgment and problem with it. But how our society decides that just because it's an STD, it's, a bad disease, or, but if you get tuberculosis because you happen to breathe someone's air on the bus or whatever, oh, that's okay disease. A germ is a germ, right? So yeah, I liked it. Because it's helping people, because the job was interesting and had such a variety of pieces to it, and that is such a needed thing for people, especially in lower socioeconomic areas. So I worked in public health clinics, which were located in those kind of areas.
And it's odd that there's such a stigma, because like you kind of need sexual interaction to like reproduce.
Like, how did you get here, right? This is how we all got here.
We can't keep the population at where it should be or where it could be without sexual interaction like that. So
that's correct. Yeah. Mm-hmm. And so, I don't know. Hopefully it's changing a lot, hopefully things are changing and there's less stigma.
May I ask, what year did you start doing all the stuff with the STDs? Public health?
I started working in 1990.
Okay, so that was right after the whole AIDS and HIV scare that was going on.
It was it was just really not really happening at the time. Yes, it was happening.
So comparing that to what's going on now, do you think a lot of people are reacting the same way to or they're putting certain stigmatisms or stereotypes? Because I know a lot of people are associating this disease with Asian cultures, or I've seen things with oh, it's how Trump said it's the Chinese disease.
Yeah, the Chinese disease. Why? Because it's from China, he said,
Yeah.
right? Yeah.
So, like a lot of, back then people were associating HIV and AIDS with a certain group of people.
Mhm.
And I'm seeing a lot of the same exact thing now.
You are absolutely correct. I have a friend who's been working on the call center. So every state has enacted a call center, just like they did with HIV in the past, in the late 80s, early 90s. And so, so I have a friend who was working on the call center, and she said that the questions were so similar, because she's my age, and so she was on the call center back then as well. And she said the questions are so similar. You're right that there's stigma going along with it. There's people asking really unusual questions like, can I get this infection from my pet? And what if I touch this or that or the other thing? And, I don't know, people regarding STDs, a lot of people say, can I get it from the toilet seat? No, it's called sexually transmitted because you get it during the sex, like germs can live on surfaces, but only certain types of germs are spread by surfaces. Now, for instance, COVID actually, right? And flu viruses, things like that. But yeah, that people are asking a lot of very unusual questions and sort of, I don't know, like you said, stigma-inducing questions and things that are, almost preposterous on how you could get the infection. So.
Do you think that's the individual's fault for not doing like their proper research or like going to like the CDC websites or stuff like that?
Yeah, it would be good if they stuck with, getting information from a source like CDC. But some people don't trust the government too, Yeah. So in public health, there is a history in public health of things not going well either. So after or around World War II, a lot of soldiers were getting syphilis from Europe and bringing it back to the United States. So it was a huge problem, and there was no penicillin to cure it just yet. Okay, it was near coming up in a few years. So anyways, there's a lot of syphilis, and syphilis can infect a baby. So when a woman is pregnant, she can infect the in utero, and the baby can be stillborn or born with symptoms or have a miscarriage. Okay, so at that time, the government, public health, your public health service, wanted to know more about syphilis, and so the people who were infected with syphilis, Black men mostly, who then they studied. They wanted to do the Tuskegee study. You guys could look it up, and if you haven't heard of it. And even after penicillin was available to treat and cure them, the public health service, and actually just one particular doctor who was in charge, decided not to treat people. And so they did not treat these men who were in the study. They didn't get treated for years and years later. I think it was like a 20-year-long study, something like that. So, so we don't always have a perfect reputation in public health either, in the government. So people are afraid of the government sometimes, and sometimes for good reason.
On that notion of choosing who to treat, the ventilator issue, doctors now having to choose between who gets one and who doesn't. Is that going to be a regular thing now, or is that just an issue of lack of resources?
I think it's the issue of lack of resources and just the influx with everybody at once. I think that is what's happening in Italy, right? That there's just so much infection and so much pressure on the healthcare system, on the hospitals, that they just can't keep up. So, given not a pandemic, then that is not normally a problem.
And there's no way in any under any circumstances, like, there could be malpractice. By
malpractice?
By not giving somebody a ventilator, but just by the notion of choice.
Yeah, but like if they don't have it, they don't have it. I mean, if it's not available, right?
Right. But if they do, say, and they choose one over the other, that's just a SOL moment, or
no, it's more of triage. It's more of a triage situation.
Right.
There is a hierarchy of, higher importance, and and who should get that
Okay.
first. You know what I mean?
Yeah.
And I, what I wondered, if more people would, who are elderly, or people who are, like myself and an adult child, and I have a father who's in a nursing home, maybe, because if when that infection gets around a nursing home, which there is one in Wisconsin that's happening, 7 of, I think 1 or 2 people died in the nursing home, and then 7 people went to the ICU. And so there's 7 elderly people at an ICU taking up 7 beds, and if it gets any bigger, and, that's going to really put a pressure on the system and the healthcare and hospital system in that community. So would more people choose maybe DNR orders not to resuscitate, some elderly people? My father has DNR orders, and if he got that infection, it's, he's not going to be, I think it's responsible because that's what he chose, and because of the illness that he has, etc. But maybe some people will think more about possibly choosing that for themselves or a family member. I don't know.
And
So
after, oh, go ahead.
Go ahead. No, go ahead.
Okay. So after the COVID virus, we'll say, is cured, once everything's like done and over with, it's out of the air, we'll say, do you think that there will eventually be like a vaccination shot once they find one that we should be getting every so on period of time?
Yeah. How many of you get the flu vaccine?
I have it.
Everybody? Most everybody?
Nope.
Everybody?
Yeah.
It'd probably end up something like that, because some people still don't get the flu vaccine. Most people, many people are getting it. But yeah, it's going to be back. What can happen is that it's going to be back, but more mild. So even if, say, in the next couple of months that we peak and start coming back down, in the fall, in the flu and cold season in the fall, COVID-19 is going to be back. But what should happen is that it's going to be a smaller bump at that time. It's going to be less and less.
You think that's the time a vaccination for this would be available?
It is so hard to tell how long creating a vaccine for this is going to take.
So what's your mindset when it comes to outbreaks like these? Are you thinking the worst case scenario, or are you more wait and see, let's see how it plays out?
I think we have to be prepared for a worst case scenario. So prepare for the worst, expect the best, and then deal with whatever comes.
How would you say the work that you're doing now differs mostly from the work that you did at the STD clinic?
Mm-hmm.
What would be the biggest differences?
The biggest difference that all of the contact tracing that we're doing is over the phone. Nobody's knocking on doors right now. Right. And I think it's amazing for this time frame, having this infection now, with everybody has electronics. I don't know anyone who does not have a cell phone or a smartphone, and how amazing. And us being able to talk so easily on Zoom today, if it were not for such amazing advances in electronics and for people using them so widely, I think this would be a lot worse. Because if we think about it, even back again in 1990, when I was on the streets of the south side of Chicago knocking on doors, some people did not have a telephone in their home. You had to walk down the street and use a payphone to get them an appointment at the clinic.
Mm-hmm.
So if people were isolated at that time when there was no interaction that you could do just sitting in your living room, I think that would be a lot worse. I know I went on a tangent there. I don't know if I answered your question.
Oh no, you did.
But
Thank
I think
you.
it's really cool that, because I was doing some of the calls to doing the contact tracing because I was writing the script, and so then I know it's different than doing STD follow up, and sometimes people are much more amenable to talking about their cough rather than their penile discharge.
Right.
So I knew it was going to be different. How much I don't know. But
If you guys didn't get that quote, you lost your.
So I was making some of the calls, and it was a family, and a divorced family, and one child in the dad's house, he had been exposed, and the other child was at the house where the mom was. The mom had the infection, and both kids were exposed. And I told the dad when I called over there, and I said, a lot of times now we're telling our kids, get off your electronics and go, do something. Let's play a game, and now you're just like, go play with your electronics. Go sit in your room and just do whatever you do on your iPad or whatever you have, or your online gaming. So I just think it's so cool that we have that opportunity for people to use things like that now. I think it's helping a lot. I think it's helping a real lot.
So I know you've touched on this, but like when you call someone about, the contact with Corona and all that, do the responses vary, or is there like more? Would you say it's more panic, or is more like just awareness?
Yeah, some people seem like, okay,
Yeah.
So I would say that there's probably 10% on either end. So 10% on one end who just could care less. They're like, yeah, whatever you say. Oh, okay, fine, I'll do that. But you could tell they're not going to really do it, or they're just they don't seem to have much care about it. A 10% on the other end who are really upset, and how did you get my phone number, and how do you know that I was exposed, and who was the person that said my name? Well, that's confidential.
Yeah.
I can't share. So, and then there's a whole bunch of gray in the middle in that 80%. So yeah.
Going back to your line of work, when, I don't know, maybe you have had, when maybe women come into the clinic and maybe they're pregnant, what do you usually recommend to them if they find out that they are carrying a disease and they are pregnant?
If they have COVID, you're saying?
No, not COVID.
Or an STD?
An STD.
If they have an STD and they're pregnant?
Yes. What do you usually recommend to them?
Yeah, it's most of the time I was dealing with bacterial STDs, and so they can be treated during pregnancy. So what the most dangerous one, as I mentioned, was syphilis, and in the early 90s, there was a syphilis epidemic really in the United States, as well as a crack epidemic. So what would happen in inner cities and lower socioeconomic communities is that women who needed money to get the drug, they were looking to get money, or they were getting the drug, crack, or getting the money to buy the drug. So they were having sex with people to get that, and there were a lot of babies who were both born to a mom who was a crack addict, as well as she had syphilis. And so I know I'm going on a tangent again, but I'll bring it back around. But but at the public health clinic, we try to make sure that they get their treatment. And with that sort of infection with syphilis, they needed weekly injections. Then you had to get them to come back, and they may not come back. But you knew you wanted to save this baby, and you want to make sure that that the mom is not infected, the baby doesn't get sick, you're not going to have a miscarriage or stillbirth, etc. And so people really had to, you had to be boots on the ground and go back and find this woman and in the neighborhood and drag her back to the clinic practically, but take her back, drive her back to the clinic and make sure she gets her treatment. So once they already have an infection and are pregnant, not a lot to do except for behavioral changes, making sure they get treated, and also making sure their partners are treated so that they don't get reinfected. So that's super important. And then recommending that people use condoms, even though she's already pregnant, use a condom, but people don't listen to that. Give free condoms, try to do what you can to just protect them, getting the infection back again. Did I sort of answer your question?
Yes, you
I
did.
go off a tangent.
No, you're fine. You answered it. Thank you.
With the whole contact tracing, it seems like really you're just a detective trying to find the who, what, when, where, how,
You're right. And you know what?
Yeah.
When I train public health nurses to do it, I tell them that you need to use open-ended questions when you're talking to someone about their partners to say, who is the last person you had sex with? Where can I find them? What's their phone number? Blah. And I would always tell public health nurses to do who, what, when, where, how, and sometimes why. Just like the vowels,
That's why.
but sometimes why, because if you ask someone a why question, like, why didn't you use condoms? Why didn't you tell your partner? Why didn't you go to the clinic sooner? Okay, so those kind of questions are, they make people feel defensive, and it doesn't really help at all, in the context when you're trying to help people with behavior change and try to get information out of them. So yeah, who, what, when, where, how, and sometimes why, and yeah.
So, I'd like to know, I know you've said you've been in this business in public health since 1990, correct?
Yeah.
How is this progressed for you in this business since that year?
Oh, that's interesting. A lot of it is the same. I suppose, again, I don't know. I got to bring technology into it again because when we go around knocking on people's doors, in the old days we just had our folder with our notes and etc. Now you can bring a laptop or a tablet or whatever and talk to people right in their home and show them pictures of the infection or what show them examples of what it might look like a herpes infection as opposed to some other skin rash, etc. So I think technology has helped it, and also having cell phones, because like I said, back in the day, people didn't even have a phone in their apartment, and you really had to knock on the door. Now with cell phones, the hardest thing is getting someone to actually answer it. Find that calling young people, sometimes they don't answer the phone, but then if you text, then they'll text back or call back then. So it's just you can get to people faster, so that's a good thing. But a lot of it is still quite the same.
In terms of people going to your clinic, because they go to your clinic to get tested first for an STD, and then you track them down to be like, hey.
Yeah, so some of it, a person would go to an STD clinic. So I work at the state health department, but in my town here in Madison, Wisconsin, it's Dane County. So they have a Dane County, Madison City Health Department clinic. Okay, so when people show up at that clinic and they're positive for infection,
Stop it.
that's going awry. So when they show up there and say they have symptoms, and the clinician is sure that they have the infection of whatever it is, gonorrhea, chlamydia, or syphilis. Probably gonorrhea and chlamydia are much more common. Then they're treated right there. They're offered medication packs that they could take back to their partners. So while we would prefer that their partners do come in to get tested and treated, there's something called expedited partner therapy where you can treat their partners right away. So that's new since 1990. There we go. Is being able to treat people without seeing a doctor, and it's a safe thing to do at this time. So so they get offered that, and say maybe they don't do any of that. They don't take the medication. I don't want to give the medications to my partner. I don't want to give them a prescription, etc. So then you would do the standard practice of having a health educator or a nurse speak to that person and ask them about their partners.
And is it commonly males or females that you speak to?
More females.
More females?
Yeah, because women have more symptoms. Being the insertive partner, there's more infections and complications that can happen to women than men. It's just a matter of like the ease of the germs being able to get in there. So women can get pelvic inflammatory disease, which is of the fallopian tubes, and they're going to have more symptoms, discharge, etc. And women are a little bit more aware of their bodies, and they're going to be going to get pelvic exams, ever since we're young, to often enough that they're just a little bit more aware, and they just care more about their health a little bit. So men who show up at the STD clinics are more often partners. They would be someone their girlfriend dragged them to the clinic, or they have symptoms. They certainly have symptoms, but a lot of women show up who just want to be tested or want to get their birth control, and they're going to get a pelvic exam, and then we find infections that we would have not otherwise found because they were asymptomatic. But men are often either symptomatic or a partner brought them there.
Going back to what you said, in the 1990s, when you said there was the whole AIDS scare, did you see a lot of gay men come into your clinic more?
No. At the public health clinic at that time, there was not a lot of gay men that would come in. There'd be some, but gay men now have a lot more, gay men and LGBT, the whole gamut, have a lot more clinics that are really dedicated to and focused on their specific health needs, and their needs culturally, I guess. I don't know, maybe that's not the right word, but so yeah, there are specialty clinics that are made just for that people, so that they feel much more comfortable. So I guess we didn't have that back in that day either. Sometimes gay men's health clinic, I think there was one in Chicago, but yeah, I think that sometimes gay men did not feel comfortable coming to the STD clinic.
Okay.
Okay, how about 2 more questions, since we've kept Ms. Stanislawski for an hour and a half, and I think I told her it would be 15 minutes.
Well, no, it's been an hour, right? It's been an hour.
It is.
So when you talk to people about the coronavirus, since there is still mystery to the virus itself, how do you educate someone when we still don't know everything about it?
And that's an important thing to tell them, that it's a changing situation, and this is what we know right now. Even just this week, the World Health Organization came out and said that people should not be taking ibuprofen or NSAIDs, non-steroidal anti-inflammatories, because their risk for infection is higher. And then they kind of backed off on that, but we're still telling people take Tylenol if you have a fever, but it's hard because it's hard to keep up with the information that's coming out, and letting people know that yes, it's a changing situation. Monitor your symptoms. If you have questions, call your healthcare provider. So we're always referring them back to a actual clinician, because the people who do the contact tracing and follow-up, like I said, sometimes nurses, health educators too. So we don't say that we're clinicians and know all the answers, but we try to give them the best information and err on the side of caution. That's the best thing to do at this time, because we don't know enough about it.
Okay, last question.
Who else has a question?
Going once, going twice.
Oh, why did you move to Wisconsin? I'm asking. Like you started in Chicago, but how'd you end up in Wisconsin?
Not a good reason, not anymore at least. I was young out of college, and so was my fiance, and he got a job up here, and so then I got married and we moved up here. Madison is a great place to live and a wonderful place to raise children. But don't move for a man. Don't do it. That's my advice.
Yeah, don't do it. Don't.
Outside of public health.
Yeah, don't ever do it.
Yeah, right. Because I thought I was a little bit older when I got married, and I thought, well, I'm gonna be having kids and stuff like that, whatever. So yes, I did work directly for CDC at that time when I was in Chicago, and then when I moved to Wisconsin, I worked for the state, but we get paid through a grant from CDC. So
Sure, if it was like for your
basically
job or
did-
something.
Pardon me?
I know if it was like for your job or something that like.
Yeah, it was for his job, and then I got the same job, slightly differently. And now he's gone, so thank goodness. But anyway.
And what she didn't tell you, and you guys can do a search on this, I'm throwing you some bait, is she was honored with the Virginia Heart Award. So write it down. Which is a big deal. It just tells you how good she is at her job. I think I actually wrote an article about that too, didn't I? I've written several articles about you.
She has.
Yes.
May I ask where you went to college?
Where did I go to college?
Yeah.
Southern Illinois University, and then Cardinal Stritch University for a master's degree.
You don't get a point for that question because that was in the bio.
Oh,
He's double checking. He's double checking.
Confirming, yes. No, that doesn't get me.
Yeah, I was just confirming, making sure everything was right, on your end now.
Yep.
What is that award, or is that something that you want us to research later?
You can ask her about it, but it's up to her if she wants to stay on. Now we're taking up her entire evening.
I don't know that I want to take up the rest of her evening.
It's fine. What's your question?
What is it, and how'd you get it?
So it was in 1995, and the Virginia Heart Award is an award given to one woman in state government every year for excellent service to the citizens of Wisconsin. And that year, as I had mentioned, the syphilis epidemic, along with the crack cocaine epidemic, we were worried about babies with congenital syphilis, babies being born with syphilis. And so I was nominated for the award because what they did is they somebody who nominated me, my supervisor actually, he looked at how many cases I had that year in my caseload, and how many women of childbearing age, and then babies that might have been saved, from getting syphilis, etc. And so he calculated prevention dollars, and we saved millions of dollars in prevention dollars, which means that if those cases would have been allowed to continue, or if they didn't get treated or whatever, that, so much money and obviously deaths of maybe babies could have occurred. So he did that like public health prediction, and then showed how much work I was doing. And that's how I got the award. So he nominated me, and I got to go to the governor's, actually first went to the Capitol, get the award from the governor, Tommy Thompson at the time. I don't know if you guys know him, but he's pretty popular. And then went to the governor's mansion. And it was really cool. It was a real honor. It was a real honor because there was a lot of women who worked in public health that I admired. And so it was really an honor to get that at so early in my career.
Mm.
Now, who else is going to ask why else would Dr. T write an article about Ms. Stanislawski?
Why else?
Oh.
There.
It's really just feeding it.
Frame your question appropriately, otherwise you're going to get the point. Come on. I taught you nothing.
She wants a full sentence. That's what I tell my kids.
All right.
Ask a full sentence.
All right.
Words.
In what other retrospect would you have written these vast articles on this marvelous person?
Did you adjective?
No, you guys are being so nice to me.
Told you they're pretty great.
So
They are. They're pretty great.
I was a professional arm wrestler. And
Really?
yes, and I won a regional tournament and won a trip to Las Vegas to arm wrestle in the World Championships. Yes.
Really?
Wow.
Yeah.
Wow.
Did you win? How'd you place?
You know what? I don't even exactly remember in that. I was like in the top 10. I don't remember that. I do
That's
remember
good.
other
Well-
things. I remember that recently when I moved last year, and I still have my trophies, and my daughter was helping me pack. She said, "Mom, why do you have so many second place trophies?" Thanks, honey.
And
Thanks.
you said that was the world or regional?
World Championships in Las Vegas. Right, I won a trip there to compete in the World Championships. And another year when I made it to the World Championships, my daughter's making fun of me. Another year when I went to the World Championships,
River and she's state
I was
champion.
arm wrestling, and her arm broke. Okay,
God.
so everyone's like, "You broke someone's arm." No, I didn't break her arm. It was, so her arm broke while I was arm wrestling. Yes, if people get in a bad position, if their arm is like this and their shoulders facing this way and their arm this way, you could have a spiral break in your humerus. And so she may have. The refs will stop the match. The refs will stop a match if someone's in what they call the arm break position, real technical. And nobody really saw it, or she wasn't in that position, or she just, I don't know what, but we were arm wrestling, and just like there was this loud snap, and for millisecond, you know how everything goes really slow when something like that happens. And I was like, is it me? Is it her? Is it me? Is it her? I don't know who, I don't know whose arm broke, because I just heard a noise. And then I saw her look at me like I was the devil, and I thought, okay, I guess it was her arm. It wasn't mine.
Oh boy.
Yeah.
But
then
you
I
won.
lost every match after that, of course. Anytime it does happen every once in a while that people break their arm. But yeah, and then afterwards, the person who was arm wrestling them loses every other match. So it really psychs you out. So those are my two exciting things about arm wrestling, I guess.
That's just a good resume builder there, I'd say.
Pardon me?
That's just a good resume builder right there, I'd say.
Actually missing one?
What? Did I miss it?
So how did you come in contact with her?
Wait, the arm break story is a little bit over the top, isn't it?
Oh yes. Well, so the so the World Championships that I won the trip to Vegas, that was a special special World Championships that year, because they were making a movie with Sylvester Stallone called Over the Top.
Oh my God.
Had you guys ever see this in the middle of the night, maybe on whatever?
I saw it like a couple of months ago.
It's horrible, isn't it? It's a bad movie.
It's
really bad.
I've seen parts of it, but I've never seen the whole movie.
Right. It's a horrible movie, but Sylvester Stallone, he just does what he wants to do, right? So they were filming the movie, and they wanted to have an actual tournament for the movie so that it seemed real. And my daughter's distracting me, I apologize. And so they had a real set of tournaments, and then had a world championship just for the movie. And so a lot of the people in the movie are real people, like the guy who wins, John Brezink Jr. Yeah, he was a real arm wrestler, and good for the movie. He was pretty cute too, so they liked that part. So he looked good on camera as well. So my matches were filmed, but I'm on the cutting room floor or something. I don't know. Can't really see. Can't see me in the film. Anyway. And how do I know Dr. T? I met her in junior high.
Wow.
That was way before 1990.
We won't talk about that.
Yeah.
Anything else for
Dr. T is my son's godmother as well. She's a great godmother. I mean, she's a wonderful godmother. I don't mean great as in like great aunt. Wait a minute. No, I mean it like that.
You're awesome godmother.
Yes, awesome godmother. To my son who asked earlier about, how do we get people to stay in their home and do what they're supposed to do? So my 18-year-old son is home from college. And his girlfriend lives in town. Normally they're in two different cities at their colleges. And I cannot get him to stay home. Dr. T, what are we going to do about him? I'm just going to Lydia's house. Okay, son. Well,
I'll send him a
there's
reprimand.
less than 10 people at Lydia's house, but still. He's splitting his time between Lydia's house and our house.
All right, we'll have a chat. We'll tell them that you tattled to my COM 222 class. And
I shall.
they disagree. All right, kids, anything else?
Mm-mm.
All
I
right.
had such fun talking to you guys. Thank you so much.
Thank you.
Yeah, thank you.
Thank you.
Holding us.
Thanks for everything you're doing.
Smile in the corner. I want to see your hands. Smile in the basement. There we go.
Thank you.
Thank you.
All right. Thank you, Ms. Stanislawski. 222, hang out for a moment so I can wrap up.
Good luck, you guys.
Thank you.
Thank you.
Bye. All right, 222ers. You got some good stuff?
Yeah.
Yeah.
Yes.
Your original assignment, which is still in the assignments folder, so you can just write this as someone came to CACC and spoke to a common class. So as part of your thing, you can say the sponsoring organization. So you can just say that you came to a comm class, or came to the comm department. So does that work?
Yeah.
Yeah.
And you want sources like if we can reach out to like other people local, you want us to do that?
Yeah.
Okay.
You could talk to some other faculty, but you guys gave some really good comments. I mean, so you know, about how this affected you, about Ben working in the market, and Whitney, how this is, you know, your story about Walmart. I mean, that's real life. So you are welcome to reach out to each other and say, can I include that? You know, you need to get permission. But I think that's significant. I think that represents what's happening. You know, if any of you know anybody who's sick, I've got several friends who are in quarantine and they're really, really sick. But I would also talk to faculty, talk to other students maybe. How are they reacting to having their classes remote? Talk to faculty, your advisors. Oh, here comes a cat. But you know what I mean? So do you know somebody who's not well and unable to get a test, for example? That would be a big story. But you know, gather as much real life what's happening as you can. A good chance to practice your interview skills.
Yeah.
Make sure you practice, you know, good journalism. Let people know it's not for publication, it's just for your, you know, class assignment.
And how many sources? Do we have to have a certain amount of sources?
You know, I don't have it in front of me, but I think I had 3, like, you know, from your assignment. So I will figure out, I'll let you know where I'm going to post this. I haven't posted these things before, so.
And this is due next Tuesday by 5 o'clock.
Correct. So you should have plenty of material. I mean, you could go a lot of different directions, but the fact that she's pulled off her STD task force, because if you think about it, a lot of people are quarantining. If you look at the market, there's all kinds of supplies. They're you know, one thing she didn't mention, but I've heard.
I'm back. I heard you talking because I had it muted.
Okay.
Yes, one thing I was going to mention. Thank you, Dr. G.
Okay.
When I went to the grocery store and the toilet paper aisles were empty,
They still
and everything
are.
was anything. I went in the sexual health section. It was, you know, condoms and then like pregnancy tests, and then condoms. The whole shelf. It's the only shelf in the whole store that was totally packed, like front facing. Every row was filled. It was just like, just right at the front facing of the shelf, like not one thing was missing. And then I thought, yeah, okay, a few months down the road, 9 months, a year, there's gonna be a lot of STDs. There's gonna be babies being born. All kinds of things are gonna be happening. So mark my words, there's gonna be an increase in STD.
Yeah. So keep that in mind. That's you know.
Yeah, keep that in mind for your own selves.
Yes.
Get free condoms at the health center, I'm sure, on campus, if it's still open. I don't know. I was thinking about doing mail order condoms. I don't know if they'll let us do that at the state.
Maybe good idea.
People could, rather than going to their health department and getting free condoms, would people mail order for condoms, or will they not do that? What do you think?
Amazon, when they give you a free roll of toilet paper, through a couple boxes of condoms.
Okay. Thanks. I still had the audio on, so I could hear you. Bye.
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 Bye-bye.
Bye.
But, unintended, public health side effect is people are quarantining and they may not be practicing safe sex. So something to think about. Questions?
Mm-mm.
No.
Okay. Ben and Cole, I sent you a note about the news.
Yeah, we got it.
Okay.
I got it.
Okay. So I will check in tomorrow with email. Let me know if you have any other questions.
All right.
Otherwise, you guys did great. I'm really very, very proud of you. I hope you.
Thank
All right.
Alrighty.
Thank you.
Thank
All right,
you.
thank you.
See you next week.
All right. See ya. Take good care of yourselves.
You too.
Yeah.
Bye bye.
Bye.